Hi, I'm Dr. 𝐂𝐡𝐢𝐵 𝐷 with Gonstead Physical Medicine. Today I'll be talking about TMD, temporomandibular joint disorder. In our first video, we went through the anatomy of the TMJ, and today I'm going to be talking about the disorders. So you might be searching this video if you have pain or any kind of problems in your jaw. Let me talk about the symptoms of TMD. So if you think about EENT, which is an acronym that you've probably heard before, those are essentially the areas that we're talking about. So if we think about the eyes, we can have eye pain, we can have headaches and migraines. If we think about the nose, we can have difficulty breathing, sinusitis. If we think about the ears, we can have earaches, ringing in the ears, infection in the ears. And then if we think about the teeth, we can have what we call malocclusion, which is the teeth not fitting right. We can have toothaches, we can have decay, we can have infection, we can have clicking of the jaw, grinding of the jaw, difficulty tracking. And of course, unfortunately, it targets women more than men. And that's because women, according to Scientific American, speak about 20,000 words a day compared to men who speak 7,000 words a day. So we are using our jaws more, opening and closing. That puts more pressure in the jaw area, but that's not the only reason. Another reason why a lot of people have TMD are acute injuries. So think of all the car accidents where somebody is hitting the windshield, hitting the inside of the door. That puts an impact, even whiplash backwards, puts an impact on your TMJ. As well, if you are sports, and you have a football injury, that can affect the neck and the TMJ area. Some people even have problems after they've had wisdom teeth removed. So injury is a big one. The next one is dental. So if they're not taking care of their teeth, that could impact and cause temporomandibular joint disorder. A lot of people come in and they're grinding their teeth at night. So bruxism is a huge thing, and that's related to stress. So stress is a very big contributor to TMD, as well as sleep and subluxation. So let me talk about sleep. If you think of my arm as your body, this is your body here, this is your head. If you're sleeping on a pillow that's too big and your head is up like that, or you're sleeping on a pillow that's too small and your head's down like this, then you're putting a lot of stress on your jaw. Not only is it bad for your jaw, but it's bad for your neck. And your neck is very important in terms of what happens in this jaw area. So subluxations to the neck, which really just means that the vertebrae are not sitting correctly, or they're tracking improperly, or there's disc problems or muscle problems, those can all cause TMD, temporomandibular joint disorder. Next, I'm going to talk about prevention. Some of the things that we can do ourselves to prevent TMD is to not chew on ice, not chew on gum. Make sure that our diet is correct. And why would diet be important in the joint? Because we can be pro-inflammatory based on what we eat. So if you're eating a lot of packaged foods, a lot of biscuits or sugar or takeout foods, then you may be putting things into your body that makes your body more sensitive to pain. And if you have any TMD, it's going to be more painful. The next thing in prevention is supplements. If you're taking supplements to reduce your inflammation, to increase your antioxidants, that's going to help any problems that you have in this area. And as I talked about before, getting a good pillow, making sure that your sleep is important, making sure that your body and your head are level when you're sleeping, making sure that you're breathing correctly. So that means you're breathing through your nose and not through your mouth. Ideally, we want to breathe in for 4 seconds and breathe out for a minimum of 7 seconds or even 10 seconds, but only through our nose. And if you have problems with this, you can even purchase tape to put over your lips at nighttime so that you're only using your nose to breathe. Next thing in prevention is making sure that your teeth are well taken care of, getting regular dental checkups to make sure that there's no grinding, no decay. And you might even need to make a mouth guard to put into your mouth so that you're not grinding your teeth at nighttime. So for diagnosis, how do you know if you have TMD? Well, you can go to your chiropractor. Your chiropractor will watch you track as you open and close your mouth. They can diagnose TMD, and so can your dentist through dental x-rays. The other ways are through CT scans, MRI, and keyhole arthroscopy. But I think that's a surgical procedure, so that would be your last option. Lastly, we're going to talk about the treatment of TMD. As I mentioned, breathing is very important. So let's start from the least invasive to the most invasive. And learning to breathe correctly is the least invasive. So breathing in for 4, breathing out for 7 seconds through your nose and not using your mouth. The only time your mouth should be open is when you're smiling, eating, drinking, chewing, or talking. Otherwise, you're using your nose to breathe. So the next least invasive treatment is chiropractic, to make sure that your TMJ is getting adjusted, to make sure that your neck is getting adjusted, that everything is well balanced and aligned well. Then there's diet, to make sure that you have a high antioxidant, low pro-inflammatory diet, to make sure that your stress is low, so that means physically exercising, work balance, relationship balance, to make sure that you're getting enough sleep, proper sleep, and supplementation. Lastly, and most invasively, you might go and make a mouth guard and go and see your dentist about your TMD. Why do I say it's the most invasive? Because once they make the mouth guard, you have that all the time. So you want to do all the things that you can do on your own before you actually take an imprint of your teeth. And when we talk about dentists, they might recommend dental surgery or jaw surgery. It may be required for TMD, but let's think of all the least invasive things that you can do to correct this first. I'm Dr. 𝐂𝐐𝐤 𝐍𝐵, and we'll see you on your next video.